Hello scholars, my name is Dr. Karis Dillon, and the goal of this channel is to make academic subjects easier to understand. In the last video, we covered part 1 of psychology and therapy. In this video, part 2, we're going to cover the different types of therapies as well as goals of therapy. So let's get started. Usually, the goal of therapy is to help a person stop repeating unhealthy behaviors or unhealthy thinking patterns that are unsafe to them. A therapist helps a person put their own life into perspective and assists them with healthier coping mechanisms to deal with stress. There are different types of therapies that exist, which therapists become licensed in. Psychotherapy is the term that's used for the type of therapy that a professional is using to help a person with their problems. One of the first types of psychotherapies is called psychoanalysis. This therapy was developed by Sigmund Freud, and it focuses on childhood and psychological trauma. Freud believed that psychological problems come from repressed memories or blocked memories that can become trapped in the body. The therapist uses methods to bring these memories into the conscious, like through dream analysis or word association. This therapy takes quite a bit of time and can even take years if there's lots of childhood trauma. The patient has to learn to trust the therapist and will eventually transfer their unconscious issues to the therapist because they are a safe person to share this with. Play therapy is a form of therapy that's used with children. Young children generally do not have the vocabulary or critical thinking skills to analyze what is happening in their lives and will often play out scenarios through art or their play. Rather than sitting on a couch, the children can play with toys, dolls, or sports equipment, and they'll often mimic what's happening in their home life or at school through their play. The therapist can just watch the child play or can play along with the child and ask questions as they go. Another form of therapy is called behavioral therapy. This form of therapy contends that all behaviors are learned through positive and negative reinforcement. If all behaviors are learned, they can certainly be unlearned if they are unsafe. Classical conditioning and operant conditioning are used to recondition behaviors. A technique that behavioral psychologists will use is called aversive conditioning. This means that each time a person displays a certain unwanted behavior, a negative stimuli is presented. The goal is to extinguish the behavior through negative reinforcements. Another technique used in behavioral therapy has to do with extreme anxiety and phobias. This therapy is called exposure therapy. When a person has an extreme phobia of something, the therapists work to calm the person by teaching them meditative techniques and slowly brings the anxiety-provoking stimuli closer and closer while the person learns to relax around the item or event. Applied behavioral analysis, ABA, is a behavioral technique that came from operant conditioning. Most human beings repeat behaviors that are reinforced within their lives. If a behavior is not reinforced, it will tend to go away. ABA has shown success with children on the Autism Spectrum Disorder. Generally, those with autism have something that they like very much, and when the therapist can pinpoint what that is, they'll use this to recondition certain behaviors that can be harmful or unsafe to the child. Another form of therapy is cognitive therapy. Now, this centers on the idea that a person's thoughts can sometimes be too negative, not realistic, or need more objective perspective. Cognitive therapists believe that a person's thoughts direct much of their behavior, and so if thoughts can be reworked, it can lead to more productive and healthy behaviors. These therapists show their clients ways that they might be thinking irrationally or inaccurately about a situation. Their client may be overgeneralizing a situation, and they may be able to offer a more rational or logical perspective. Cognitive psychologists often notice self-defeating behaviors and attempt to help people with depression, PTSD, those with bipolar disorder, eating disorders, or those with suicidal ideations. Cognitive behavioral therapy is especially popular right now. CBT uses what is called an ABC model. A stands for actions, B stands for beliefs about the event, and C stands for the consequences of the behavior or belief. This can be especially useful for someone that thinks in an all or nothing mode. Humanistic psychology has a therapy called client-centered therapy, which was created by Carl Rogers. Humanists believe that people have free will, and when they become self-aware, they can reprioritize their life and reach their highest potential. Humanists believe that all human beings are essentially good. The therapist allows the client to direct the session, and the goal of the therapist is to mirror back to the client what they are offering them. It is through this mirroring that the person can see what their own issues are and how they can reprioritize their life in a more successful manner. The therapist has to have unconditional positive regard with their client and consistently empathize with them. During a session, the therapist actively listens to what the client is saying and then restates it in a different manner. They attempt to clarify what the person is trying to say. They cannot come across as judgmental and must show the client that they're accepting of who they are. It is the belief that if the therapist is fully accepting of the person, then the person will become more accepting of themselves. There are definitely other forms of psychotherapy, but those are the main ones that professionals become licensed in. Usually a therapist will use many different therapy techniques and create their own style. If a person is going to have successful therapy treatments, they want to look for 3 indicators of success. The treatment that the therapist uses needs to be evidence-based, meaning it has worked in the past with many other clients. The second factor is having a therapist that has an expertise in the therapy that they're using. The third item is what the patient themselves brings to the therapy session. If a person is forced into psychotherapy, the chance of them making changes to their own life can be limited. Those that are open to therapy and open to objective offerings often mean much more success. This is why the relationship that builds between the client and the therapist is extremely important. Psychotherapy on its own is very effective, but psychotherapy with a combination of medications has shown to be the most valuable when a person is suffering from a major mental illness or trauma. When a client sees someone for medication, such as a psychiatrist or a general practitioner, this is called biomedical therapy. Medications that are used to treat psychiatric or psychological issues are called psychotropic medications. When someone suffers from major depression, they're usually treated with antidepressants. Those with bipolar disorder are usually treated with a mood stabilizer. Those with psychotic disorders like schizophrenia are often treated with antipsychotics. All of these medications work with the neurotransmitters within the brain or the receptor sites. These medications do not completely cure these mental illnesses. Sometimes individuals with depression can eventually get off their medication, but 50% of the time, they will remain on them for the rest of their lives. Once a person decides to seek therapy, voluntary or involuntary, a professional will assess what their client's needs are. A specialist will meet with the client and decide what their presenting problems are and talk to them about what to expect in treatment. The therapist must have confidentiality, which means the therapist is not allowed to disclose any personal information about the client unless mandated by a court to do so. The client and the therapist will work on what their goals of therapy will be. Eventually, a treatment plan will be created for the individual and discussions about the length of therapy will be covered. There are different types of therapy, including individual therapy, group therapy, and couples therapy. Individual therapy involves the client and the therapist. They meet one-on-one either weekly or every other week. This can be in an office or online through the computer. The therapist will assist the client with exploring their own feelings, work through issues that are coming up in the client's life. They'll define the goals that they hope to achieve and make changes that they hope will bring about better and healthier routines. Group therapy is when a client meets together with several clients with similar issues or problems. When children are taken care of, it's important to match them for age and similar problems. It can help to decrease a client's shame or isolation about a problem while offering needed support. And group therapy does have its limitations, though. Sometimes members of the group will not share information because they're embarrassed or feel shame. And there are tons of concerns about confidentiality. A benefit, though, of group therapy would be that members can confront each other about their patterns. Group therapy is a recommended treatment for a lot of addictions or other issues. Many will do better because they see other individuals with like issues, and those people will often comment on the behaviors of others. Those groups that have strong educational components are called psychoeducational groups. During a group session, the entire group can reflect on an individual's problems or difficulties, and others might disclose what they have done in a situation. The focus for the therapist is to make sure everyone is benefiting and participating within the group, and that no one person is the focus of the entire session. Now, couples therapy involves a therapist with two individuals that want to work on their relationship and work through some of their difficulties. The two individuals could be dating, courting, engaged, married. The two individuals will talk about things that they want to see changed in their relationship, and the therapist will help both individuals see how their upbringing, how their values and beliefs and their behaviors might be impacting the relationship. Sometimes the relationship has become so unhealthy, though, that the couple needs help deciding whether or not they're going to stay together in the long term. Many therapists believe that this is one of the most difficult types of counseling to do, marital counseling or relationship counseling. Family therapy includes the therapist and the individuals of a family, oftentimes including the children. With family therapy, the systems approach is usually used. Now, this is when a family is viewed like an organizational system, and each member of the family has a role and kind of contributing responsibilities. Each family member is shown how their behavior can impact others. So as the therapy progresses, each member of the family is helped not only to grow as an individual, but to help the family to grow. It's amazing how one member of a family having problems can really impact the whole family. Structural family therapy is when a therapist discusses the boundaries and structure of the family, as well as who will make the rules, which rooms people need to be sleeping in, and how decisions will be made. Another type of therapy that is sought by individuals is addiction treatment. Addictive substances can often alter the neuroconnectivity of the brain, specifically in that prefrontal cortex. This is the portion of the brain that involves judgment and decision making. So about 40 to 60% of individuals that quit various substances end up relapsing. Those with addiction are often helped with long-term therapy. What we need to remember as a country is that treatment is so much less expensive than incarceration. Treatment for addiction tends to be more successful if it occurs for more than 3 months. So with treatment, there's a reestablishment of cognitive, behavioral, and social behaviors. Treatment can also include helping an individual for their cravings and to create strategies to help prevent relapse. Addiction is not just about treating the addiction, but helping to meet the psychological needs and conflicts that have been in the past as well. The therapist can help with communication, relationships, how to parent, how to deal with stress, even legal issues sometimes, and job issues. Group therapy for addiction can be very helpful as well. Individuals that surround themselves with other sober individuals tend to stay sober. Former addicts help to support, confront, identify, and help people with feelings and to know they're not alone. All right, well, this is the end of the video. I hope you enjoyed it. If you did, please hit that like button and don't forget to subscribe. Keep up your studies and know I am right there with you. Have an amazing day, and I will talk with you soon.